Hello, everyone. Good afternoon, and welcome to part 2 of prevention and mitigation of common infectious illnesses in schools and childcare. This presentation, as Kendra had mentioned, is being presented by New Jersey Department of Health's DISH team. DISH stands for Daycare, Schools, and Higher Education Settings. Our team's mission is to provide education and training to strengthen public health and minimize infectious disease transmission in educational settings. Part 1 of this presentation series was last August. However, if you missed it, you can always revisit the recording on the DISH team's webpage. The link to our webpage, as well as the hyperlinks to every resource that we are talking about today, can be found in this slide set. So don't worry, after today's presentation, you will receive a copy of this slide set, which will contain all of the resources we are mentioning. That way, if you want to learn more about what we're covering following today's presentation, you can do so with the links and resources that we are providing. I also want to mention that all of the information that we will be reviewing today can be found on the New Jersey Department of Health, CDC, and Environmental Protection Agency websites. And as I mentioned, if you missed part 1 of this series and would like to see it, we do have the recording on the DISH team webpage. There is a hyperlink on the top of this slide, which will bring you to the webpage, and the recording for part 1 is located right here. And for a quick recap, in part 1 of this series, we discussed acute respiratory illness, influenza, hand, foot, and mouth disease, norovirus and gastrointestinal illness, strep throat, and lastly, fifth disease. In the registration for this webinar, some of you submitted questions about these illnesses, and we wanted to thank you for your submissions and encourage you to go to our webpage and watch part 1, which will address questions on the diseases listed here. Today, in part 2, we will talk a little bit about outbreaks of infectious disease and how to recognize if an outbreak is occurring in your school or childcare center. We'll also cover other common childhood illnesses, which we didn't cover last time, including conjunctivitis, a number of skin conditions caused by staph or strep bacteria, scabies, and ringworm. The page you see here on your screen is the New Jersey Department of Health School Health page. This is the go-to page for guidance, forms, and recommendations for communicable diseases in school and childcare settings. Most of the documents we will reference today can be found on this page. And on your screen here, you will see the school and childcare exclusion list, which is posted on the school health page that we just showed you. This is a resource that lists some of the most common childhood illnesses in childcares and schools, with details about the exclusion criteria for those illnesses, a list of common symptoms for each illness, and whether the illness should be reported to public health. This presentation series highlights the school and childcare exclusion list, so every illness that we discussed in part 1 and that we will discuss today in part 2 can be found on this document. And before we jump in, please remember that your local health department should always be contacted when you have infectious disease concerns. Childcares and schools are required to notify local public health about outbreaks and suspect outbreaks of any disease, as well as even single cases of reportable diseases. A list of reportable diseases can be found on the school health page as well. It's important to notify public health when you think you might have an outbreak so that they can help you to determine what actions you can take to stop disease transmission. For example, they could help you with disease-specific messaging that can be sent to parents and or guardians when your school has an increase in illness. In case you need the contact information for your local health department, I've included links to a local health department finder tool on this slide. So to begin this session, we're going to revisit a disease that we discussed in part 1, strep throat. If everyone can help me answer this poll question here. We have 5 toddlers in the ABC Childcare Center, and they've been diagnosed with strep throat in the same classroom this week. These individuals do not interact with each other outside of the childcare center. Is this an outbreak? And I'll give everyone a few, some time here to just answer yes or no. All right, let's take a look and see what we have as our results here. All right, that's great. Thank you so much for everyone that answered. The correct answer is yes, that this is an outbreak.
Hi, Sarah, is it still showing?
I apologize. I'm having some technical difficulties. Just one moment, please.
Sarah, you can click on share results if you need, and that will share them. And then you can pull up the next question from the toolbar usually.
Thank you so much for your patience. I apologize. All right. And as I said, the answer is yes, this is an outbreak. And if you weren't quite sure how to answer our poll question, let's take a look at the general guidelines for the control of outbreaks in schools and childcare settings document for some help. This document that we see here, which can be found on the school health page, reviews reporting requirements, how to identify if an outbreak is occurring, and recommendations for outbreak management. To answer our poll question, we're going to turn to this document, which gives good advice about when you might suspect that an outbreak is occurring. At the bottom of page 1, it says an outbreak may be occurring if, and then it lists 4 different red flag scenarios that are a signal to call your local health department so that they can help you assess whether or not you have an outbreak. Let's look at these 4 red flags in more detail on the next slide. The red flags that you see listed here on your screen can be used to figure out if an outbreak may be occurring. First, if you notice several children who are exhibiting similar symptoms are in the same classroom, the same wing of a facility, or attended a common event, you should call your local health department to see if you have an outbreak on your hands. And this is exactly what happened in our poll question. We had 5 kids with strep throat all interacting within the same class. Second, we have if there's an increase in school absences with many parents reporting similar symptoms as a reason why their child is not attending school, call your local health department. Third, if you see 2 or more students diagnosed with the same reportable disease, in that case, once again, you'd want to call your health department. And if you need a list of reportable diseases, you can find one hyperlinked to this slide, as well as in the footnotes of the exclusion list. And finally, if a single case of a highly infectious disease, such as measles or pertussis, comes to your attention, certainly we're going to want to call our local health department. And when you speak with your local health department, you will want to be prepared to answer some questions about the outbreak. Local health departments will need to gather information about the person, place, and time of the situation. They may ask for the number of children and staff at your childcare center or school, sometimes referred to as your census. They may also ask you to tell them about those that are ill. Some additional questions that they may ask include, have you been notified that a particular diagnosis for these individuals, such as strep or RSV? What symptoms have they been experiencing? Could the cases be connected in any way, or are they in any of the same classes, or maybe they ride the same bus? Do they participate in any known extracurricular activities together, either inside or outside of the school setting? And lastly, the health department will always want to know the timeline of the suspected outbreak. So, for example, when did that first student become ill? And then what about the last student or most recent student? This information helps the health department determine when the outbreak may have started and if it is still ongoing. And some of you may be familiar with the illness log or line list that we see here. It can be a very helpful tool. If a concerning situation does arise, all of the information that your local health department will need can be documented and easily shared. If you need an illness log template, you can access the one that we see here, which is actually a fillable Word document, by clicking on the link in the title. And although we should know that we are working on a new template and it should be available shortly on our website. And for our next poll question here, speaking of illness logs, can you help my team understand how this process may work at your childcare center or school and answer this poll question for us? So my childcare school keeps electronic copies of illness logs that can easily be forwarded to public health if needed. So is that number one? Yes, I keep a record of illnesses on an Excel file or other computer application, which makes it easy to send. No, we still use paper copies. No, we log the illnesses in an electronic record, but it does not easily convert to a report that can be sent to the health department. We do not keep illness logs. Or other, and I will give you a few moments to read that over and go ahead and answer that for us. All right, okay, thank you so much. If we could go ahead and see the results for those. All right, it looks like yes, okay. Most of you do keep a record of illnesses on an Excel file. All right, that's great. That's wonderful information. Thank you all so much for answering that for us. The DISH team really does want to strengthen public health's relationship with childcares and schools, and this information can help us to help you. So thank you again to everyone who took the time to respond. We really appreciate it. And moving on, we're going to transition to the common childhood illnesses that we will be discussing today. And as we mentioned, they can all be found on the school and childcare exclusion list that we looked at earlier. So let's dive in and discuss our first illness for the day, which is conjunctivitis, or commonly known as pink eye. So as it turns out, the symptoms and exclusion for conjunctivitis will vary depending on the type of conjunctivitis that we are talking about. On the exclusion list, you will see that there are two rows for conjunctivitis, one for purulent and the other for non-purulent. Purulent meaning a white or yellow discharge that can mat the eyelids, or non-purulent that may still have discharge, but discharge may be clear or watery. Those with purulent conjunctivitis will need to be excluded until they are examined by a medical provider and cleared to return to the child care center or school. Those with non-purulent conjunctivitis do not necessarily have to be excluded unless they have additional symptoms, as non-purulent conjunctivitis can be due to allergies or some other eye irritation that isn't necessarily contagious. And as you may already know, pink eye is extremely common. According to CDC, public school kids in the United States miss 3 million school days each year as a result of pink eye. Pink eye can be caused by several viruses, such as adenoviruses, or by bacteria, such as Staphylococcus aureus, in which case it's highly contagious, or by allergens, such as pollen or eye irritants like smoke or chemical vapors, in which case it would, of course, not be contagious. We won't often know exactly which pathogen or germ is causing a case of conjunctivitis, but we do know contagious conjunctivitis can quickly spread through close personal contact, such as holding or shaking hands, touching an object with germs on it, and then touching your eyes, or by respiratory droplets in the air from coughing or sneezing. Prevention tips for conjunctivitis include encouraging frequent hand washing by incorporating it into your daily routines. Additionally, it's best to avoid sharing personal items such as eyeglasses, towels, and bedding. And of course, when you suspect that a child may have purulent conjunctivitis or pink eye, the child should be excluded until they are seen by a medical provider. And on the screen now, you will see some recommended cleaning, sanitizing, and disinfecting protocols from New Jersey Department of Health's Environmental and Occupational Health Program. We want to remember that cleaning with soap and water, unfortunately, is not always enough. It's important for childcare centers and schools to know when to clean, when to sanitize, and when to disinfect. And this chart is a good resource and shows which areas or objects require which method. So I'm just going to give everyone just a moment to take a look over this list. I know it has a lot of good information. So as we see here, cleaning occurs with the use of soap, water, and friction to remove all visible dirt. Sanitizing, however, reduces or can reduce the amount of invisible germs on inanimate surfaces and is appropriate for items such as tables, high chairs, toys, and pacifiers. Sanitizing products are less harsh than disinfectants. Disinfecting destroys or inactivates almost all bacteria and viruses on inanimate surfaces. Disinfecting may be appropriate for items such as diaper changing tables, door and cabinet handles, toilets, and other bathroom surfaces. Before sanitizing or disinfecting, it's recommended to first clean the object or surface. Cleaning with soap, water, and friction actually exposes germs and helps the object or surface be properly sanitized and or disinfected. The link on the top of this slide will take you to the New Jersey Department of Health document that has this chart, as well as some tips for choosing products for cleaning, sanitizing, and disinfecting. It's important to remember to routinely clean and disinfect commonly used items like doorknobs, cribs, water fountains, diaper changing tables, and sleep mats. And products that are approved for sanitizing and disinfecting should have indication that they are approved by EPA somewhere on the label. Whenever you buy a new product, you want to make sure to read the contact time on the back as well. Contact time is how long the product has to stay on the surface to kill the germs. So, for example, if a product has a contact time of 10 minutes, but you were hoping for a product that can be used very quickly, you may need to keep searching for a product with a shorter contact time. And of course, it's always important to read the directions for use and make sure you are safely using these products. The next few slides here are all focused on skin conditions that are caused by either Streptococcus or Staphylococcal aureus bacteria. We have 3 different entries on the school exclusion list that refer to these conditions, and we will look at each one separately, but they are very closely related. So the description of these conditions may overlap with each other, and prevention measures will certainly be similar throughout. When an individual has a staph or strep skin infection that is not diagnosed as MRSA or Impetigo, You can follow the row on the exclusion list that just says staph or strep skin infection. MRSA and Impetigo have their own row on the exclusion list, so we will discuss them individually. Individuals with staph or strep skin infection diagnoses should be excluded if their lesions cannot be adequately covered. Staph and strep skin infections are not reportable when it's just one individual case. However, if your school or childcare center hears that several children within the same class, cohort, or sports team all have been diagnosed with one of these skin infections, then it does need to be reported to your local health department. And here again, we see the exclusion list. This slide is just to highlight that it does contain all of the pertinent information for exclusion for staph and strep skin infections. And again, it's a great tool to refer back to if you have questions. Another childhood illness that can be caused by staph or strep bacteria is impetigo. So we're going to take a look at that now. Impetigo is a common and highly contagious skin infection that typically appears on the face, like we see here in the picture, but can occur on the arms and legs as well. It develops into fluid-filled blisters that produce a honey-colored, crusted yellow scab, but at first may look like small red pimples or sores. Impetigo is caused by group A strep or Staphylococcus aureus bacteria. Individuals diagnosed with impetigo should be excluded from child care centers and schools until antibiotic treatment has been initiated. It's also good practice to make sure that lesions can be adequately covered until they have dried and scabbed over. If facial lesions cannot be covered, the child may still be permitted to attend school. It's also important to remember that the exclusion list provides the minimum amount of time that a student should be excluded from school or childcare. It's possible that a medical provider may recommend a longer exclusion time frame than what is listed on the exclusion list. In that situation, we always want to follow whichever exclusion is longer. Students should not return to school or childcare before the recommended time frame referenced on the exclusion list, though. And again, you only have to report outbreaks and suspect outbreaks of impetigo to the local health department, not just individual cases. So we must also keep in mind that strep and staph bacteria that cause impetigo can actually present in other ways as well. So if there is an increase in illness above the norm at your child care center or school with reports of impetigo or staph or strep skin infections, be sure to loop in your local health department, even if the kids are getting slightly different diagnoses, because they could all be related. And impetigo is most common in children ages 2 to 5 years old. And as we mentioned, when strep or staph bacteria are able to enter the body through a cut or a break in the skin, it may present as impetigo. So that means that individuals who participate in activities with close physical contact or where cuts and scrapes are common are at an increased risk for getting impetigo. For that reason, skin conditions like impetigo are common amongst athletes, especially those who wrestle or play high contact sports. In fact, for many of the conditions we were discussing today, the New Jersey Department of Health School and Child Care Exclusion List provides recommendations that are specific to these athletes. And though we won't be covering sport-specific exclusion recommendations today, if you're interested in learning more about infectious disease prevalence and prevention in student athletes, please reach out to the DISH team for more information about our training geared specifically to school athletics. Crowded conditions in schools and childcare can also increase the spread of impetigo. So, and it's important to know it's more common in areas with hot and humid summers and mild winters, but really it can occur anywhere. And lastly, those diagnosed with scabies, another illness that we will be discussing today, are also at an increased risk for impetigo. Scabies, which causes intense itching and scratching, can create those small openings in the skin, which unfortunately gives staph or strep bacteria the opportunity to enter the body. So as with all illness prevention, it's so important to have good hygiene to remain healthy. And with that in mind, we will now talk about Impetigo prevention. In addition to routine hand washing, make sure to clean, all minor cuts and breaks in the skin with soap and water. And additionally, cleaning and disinfecting is a very important prevention method. It's also necessary to regularly wash any linens or bedding you may have in the childcare center or school, and to be sure to cover all open wounds. Additionally, CDC recommends that those with open wounds should avoid spending time in swimming pools and any natural body of water, such as lakes. And lastly, strep, one of the bacteria that can cause impetigo, can also be spread via the respiratory route as well. So teaching kids good respiratory etiquette, like covering your mouth when you cough or sneeze and covering into your elbow instead of your hands, is extremely important. And speaking of prevention tips for infectious diseases, we were hoping we could get your input on which printed items you think you would that would be useful in your educational settings to assist with infectious disease prevention. So we want everyone's thoughts. So please answer whether you which items you would find useful here. And we'll give everyone just a few moments to answer these questions, or answer which items would be most useful for you, whether it would be age-appropriate hand washing or respiratory hygiene signage and posters, coloring books, or a binder with printed resources, or all of the above, or none of the above. So go ahead and we'll give you a few minutes to check those off for us. All right. Okay, great. Thank you all for taking the time to answer that for us. We will, thank you for putting those results up there. That's wonderful. Thank you so much. This information will really help us. And next up, we will now transition over to my colleague, Victoria, who is going to be talking a little bit about MRSA with us today. So thank you.
Thank you, Sarah. So now let's transition to MRSA. MRSA stands for methicillin-resistant staph aureus. MRSA is a strain of staph bacteria that has developed a resistance to certain antibiotics on the market, such as the antibiotic called methicillin. So the main difference between MRSA and the other staph skin infections we've already discussed today are the type of antibiotics that can be used to treat it. When there are individuals with red bumps that progress to pus-filled boils or abscesses, MRSA may be suspected. Individuals diagnosed with MRSA should be excluded if their lesions cannot be adequately covered. So that means if you can cover those lesions, then the child may continue to attend the child care center or the school. MRSA is only reportable to local public health if there is an outbreak occurring or if you suspect that an outbreak may be occurring. A MRSA outbreak is defined as 2 or more non-household confirmed MRSA cases that occur within a 14-day period and are epi-linked to each other. So epi-linked means there is a connection between the 2 cases that could explain the transmission of the disease. So just for example, if you were notified of 2 MRSA cases and they occur within the same week, and you find out that they're on the same wrestling team that practices together every day, then that is certainly an example of epi-linkage. So you would need to reach out to your local health department to ask if any other action is needed. Of course, all the information I just covered about MRSA can be found on this childcare and school exclusion list. So we do have the hyperlink for it here in case you do need to access it later. New Jersey Department of Health also has a document that lists strategies for the prevention of MRSA in schools and child care centers. There are several strategies for MRSA prevention within this document, And we'll be discussing some of these strategies in more detail over the next few slides. MRSA, impetigo, and staph skin infections all have the same risk factors. Those risk factors include living or working in crowded areas, having frequent skin-to-skin contact, or having open areas on your skin like cuts or lesions, or even dry skin. And poor hygiene can also increase your risk as well. CDC has fact sheets that are available for MRSA. You can see that they have one for childcare in schools. They also have one tailored to parents. So feel free to read these in detail later. And if you like them, maybe you can send the one that's tailored to parents to your communities for education. So the prevention measures for MRSA are the same as those we have discussed for other skin infections. Making sure everyone is practicing good hand hygiene is essential. In order to help with this, we have included some coloring pages you can click on and print off to help with hand washing education. Schools and childcare centers should also have protocols in place for handling soiled clothing, blankets, and towels. Students and attendees should actually never share these items, as sharing these materials can contribute to an increase in infectious disease. It's also important to educate parents. Parents and guardians in your communities should know they need to contact your childcare center or school if they notice that their child does have an unusual or concerning area on their skin. Parents can also be educated on the importance of keeping cuts and scrapes clean and dry and covered. Generally, a child with MRSA should not be excluded if the infected area can be covered by a clean, dry bandage. Remember, these infections are transmitted by skin-to-skin contact and by touching surfaces that have come in contact with somebody else's infection. So, of course, it's always very important to routinely clean and disinfect as well. But it is important to make sure that you do have a product that is effective against MRSA in your normal cleaning and disinfecting protocols. This is from the EPA, and it lists specific products that can be used to disinfect against MRSA. When you do open this document, you will find some products that you may already be using. For example, Lysol and Clorox wipes are included on this list. This slide has CDC's bank of fact sheets and posters that they have available for MRSA. There are some additional flyers that you can access through this link that you can send to parents for education. There are also a lot of resources out there about MRSA and athletes in case you need them. Participating in sports does involve a lot of skin-to-skin contact, and there is often equipment sharing involved, and that, of course, increases the risk of transmission. So before we move on to our next illness, can you help me to answer this poll question? So ABC School is notified of 2 students who are diagnosed with impetigo, 1 student who is diagnosed with cellulitis, and 1 student who is diagnosed with a staph skin infection. This all happens within the same week, and they're all within the same class. So what should the school do? Should they notify the local health department to ask if anything else needs to be done? Or do they not need to do anything because these are all different illnesses? So I'll give you some time to answer that. Okay, let's take a look at our results. Great, 86% of you said to notify the local health department to ask if anything else needs to be done. So scenarios like this can be confusing because most of these kids did have different diagnoses. And even though we didn't talk about cellulitis today, staph is one of the bacteria that can lead to that diagnosis. And we know from earlier in this presentation that the staph bacteria can lead to a staph skin infection diagnosis. And we know that impetigo can be caused by staph bacteria as well. So the same underlying pathogen could be causing an outbreak in this school. So whenever you're unsure and you just see an increase in illness, be sure to reach out to your local health department to discuss. So now let's move on and talk about scabies. Scabies is a parasitic infestation of the skin caused by a human itch mite, and it's transmitted person to person, usually through direct contact. An individual may have scabies if they have itchy raised patches or burrows on their body. Individuals with scabies should be excluded until after their topical treatment has been given. If scabies is suspected, make sure the individual does see a medical provider because there's actually no over-the-counter treatment available for scabies. It is important to report outbreaks or suspect outbreaks to public health, and a scabies outbreak is defined as 2 or more scabies cases that are epi-linked to each other that occur within a 4-week period. So here's the school and childcare exclusion list again. All the information I just covered can be found here as well. And this is the scabies manual from New Jersey Department of Health. So local health departments will use this manual if they're helping with the scabies investigation. It includes all the information I am getting ready to tell you about scabies, plus a whole lot more. Additionally, on the screen right now, you can see examples of what a scabies infestation may look like in children. So first thing to note is scabies can be transmitted by direct, prolonged skin-to-skin contact. It's also assumed that scabies can infest individuals through shared clothing, bedding, carpets, and furniture. On a person, the scabies mite can survive for 1 to 2 months, but off of a person, it can only survive for 48 to 72 hours. So let's talk about the incubation period for scabies. An incubation period is the time from exposure until symptoms develop. The burrowing and feeding process of the mite that individuals are exposed to causes irritation and allergic responses to that infestation. If a person has never had scabies before, symptoms can take as long as 4 to 6 weeks to appear after exposure to the mite. But if a person has had scabies before, symptoms may appear sooner, within 1 to 4 days after exposure due to hypersensitivity. So reinfestation with scabies is possible. So now we are going to go through briefly the scabies outbreak checklist for childcare and schools. This is located in the scabies manual I showed you. So you should, of course, always work with your local health department to determine if you do have an outbreak by reporting the situation to them. It is very important to exclude scabies cases until topical treatment has been given. And the childcare and school should work with their local health department to complete a line list of cases. They should also work with their local health department to see if any notification needs to be sent out to parents and guardians about the outbreak, and close contact should be identified for treatment. And bedding and clothing that a person with scabies may have used should be laundered. So this is just a summary of that checklist. There's, of course, more detail in the scabies manual, which can be found by clicking on this link. But from that checklist, you probably noticed that if there is a scabies case reported, we would ask about close contacts. An individual who has had prolonged skin-to-skin contact with a scabies case or handled infested clothing or bed linen of an infested person would be considered a close contact. You'll notice that this close contact definition is a lot different from the close contact definition we're used to working with for COVID-19. And that makes sense because scabies is not transmitted the same way as COVID-19. It is important to remember that when you do have a scabies situation on your hands, all cases, their close contacts, including their family members, must be treated for scabies at the same time to avoid reinfestation. Your local health department can always work with you to help assess whether any other students or staffs would be considered close contacts. It's important to identify close contacts so that they can receive treatment. Children typically have direct contact with each other, which can increase the chance of transmission within a facility. Scabies outbreaks occasionally occur in daycare centers because young children tend to play in ways that involves a lot of skin-to-skin contact. So if you do identify a scabies outbreak, this is a sample notification letter, which can be found in that scabies manual I previously showed you. Schools and childcare centers should reach out to their local health department prior to sending notifications about outbreaks or illnesses. Your local health department can always work with you to tailor the notification to your specific situation. The scabies manual also says that bedding and clothing worn next to the skin during the 5 days before the start of treatment should be laundered using a hot water cycle and a hot drying cycle. Items that cannot be laundered should be placed in plastic bags for 7 days. Okay, so now moving on, our last illness of the day is ringworm. Ringworm is not caused by a bacteria or a virus or a parasite. There's actually no worms involved when we're talking about ringworm. Ringworm is actually a fungal infection. So our exclusion list has 2 different rows for ringworm, and the symptoms do differ depending on where the ringworm presents on the body. But the exclusion is the same for all ringworm diagnoses. Individuals with ringworm should be excluded from the childcare center or the school until after treatment has started. Individual cases of ringworm are not reportable to public health, but outbreaks or suspect outbreaks of ringworm are reportable. So here's our exclusion list again. You can see that individuals can have ringworm of the scalp or ringworm of the body. Those with ringworm of the scalp may experience hair loss in the area where those lesions form. Those that have ringworm of the body may have circular lesions, and they can be found on the face, the trunk, or the limbs, and itching is very common. You may have also heard of the term athlete's foot. That's actually a form of ringworm as well. The treatment for ringworm depends on the location of the body and how severe the infection is. Some forms of ringworm can be treated with over-the-counter medication like antifungal creams, but other forms do need treatment with prescription oral antifungal medication. Okay, so time for another fun fact. According to CDC, approximately 40 different species of fungi causes ringworm. Ringworm can be transmitted by skin-to-skin contact, as well as by sharing clothing, towels, combs, or other personal items. Animals can actually have and transmit ringworm as well, so that means cats and dogs can have it. An individual can also get ringworm from the environment. The fungi that causes ringworm can live on surfaces, particularly in damp areas like locker rooms and public showers. CDC says the symptoms for ringworm usually appear between 4 to 14 days after the skin comes in contact with the fungi that causes it. This shows an infographic from CDC that you now have available to you through this slide. It does list prevention tips such as keeping your skin clean and dry and washing hands after touching pets. So as I mentioned, animals can have and transmit ringworm. So if you do have classroom pets, make sure to have good procedures in place for hand washing after handling those animals. This infographic also mentions to avoid walking barefoot in locker rooms, gyms, or public showers, and to avoid sharing towels, sports gear, and other personal items like clothing, hairbrushes, and hats. Individuals may be at an increased risk for getting ringworm during high contact sports because of the close skin-to-skin contact and because of the equipment sharing involved. So pay close attention to cleaning and disinfecting in locker rooms, and remember to think about the equipment that does have to be shared, like exercise equipment and wrestling mats. Those items should be routinely cleaned and disinfected after each use. In general, if an individual is diagnosed with ringworm, it's important to keep the affected areas covered and to make sure that individuals with ringworm are not at the childcare center or school at all if their treatment has not been given. Of course, if you want to learn more about ringworm, you can always check out the CDC ringworm page, which has a lot of great information, and we have hyperlinked it to this slide. Okay, so we've made it through our list, and that sure was a lot of information. But remember, you will have the slide set to reference with links to resources in case you encounter these illnesses in your childcare center or school. So if you have any questions about anything we just said, you'll be able to find these resources later. We do have one last poll question for you. So can you let us know if you've already seen any of these illnesses in your childcare center or school? Please choose all that apply, and I'll give you some time to do this one. Okay, let's look at those responses. Wow, okay, so some of you have definitely saw some of these illnesses before, so hopefully these resources will be helpful for the future. So this wraps up our two-part series. We have reviewed the basics for all the diseases that you see on your screen right now, either in today's presentation or in August during part 1. Please note that the exclusion list has recommendations for exclusion timeframes for when illness occurs within your childcare center or school. We provide you with this exclusion list as a baseline to help keep your childcare and school operating while also balancing keeping those who are most contagious excluded. Please note, because we know the exclusion list may not address every situation, we also stress the importance of continuously reaching out to your local health department. There may be situations in which your local health department recommends stricter exclusion than our New Jersey Department of Health exclusion list in order to halt transmission, such as during a large outbreak. Though we hope we are able to provide you with tools in our webinars to help you to manage infectious diseases when they enter your childcares or schools, several decisions about infectious disease management may need to be made on a case-by-case basis in consultation with experts at your local health department. Each scenario is unique and may require more specific actions than we highlighted in our webinar. All of this to say, we know many of your local health departments personally, and they are wonderful individuals who are ready to help you should you need them. So thank you so much for attending today's webinar. If you have any questions for us, please put them in the Q&A box at this time. Additionally, this QR code will take you to our webpage where you can see our past webinars, as well as resources to help you with other infectious diseases we did not talk about today. If you do have time, please consider completing the evaluation